Hi guys, in this video we'll talk about the anatomy of the abdomen and pelvis in the CT. I have this pulled up in PACSBIN. This was created by Dr. Michael Hartung from Wisconsin. Let's get started. The first thing I briefly want to talk about is how to identify if a CT scan was taken with IV contrast or without IV contrast. And one of the best clues is just to look at vessels, and usually aorta is the best one. If you see contrast in the aorta, then this CT was taken with IV contrast. I have a few examples from Radiopedia. So let's look at this CT non-contrast. And if we take a look at the aorta, there is no contrast in the aorta. Similarly, in the blood vessels in the liver, we don't see any contrast. The other body part we can look at is the kidneys. Kidneys receive 20% of the cardiac output, so they're pretty vascular as well. And in this non-contrast study, we don't see any contrast. If we go back to our CT taken with IV contrast, then there's a lot of contrast in the aorta, in the hepatic veins, portal veins, and just compare the kidneys that we see here to the kidneys that we see here without IV contrast. So that's usually the best way. Now let's go back to the anatomy. Usually I start with the liver, and I usually go, up and down in different parts of the liver. Um, there's our IVC coming off the right atrium. There's three branches of the IVC: the right hepatic vein, the middle hepatic vein, and the left hepatic vein. If we go down more, we find our portal vein. The portal vein branches out into the left portal vein and the right portal vein. The right portal vein branches out into anterior and posterior branches. As we go down more, we see our gallbladder. And then from the gallbladder, we can follow the biliary tree. Normally, the bile ducts are small and hard to see, and they're usually more easier to see if there's some disease or pathology causing them to be dilated. Right here is our common bile duct inside of the pancreas, and the common bile duct goes into the duodenum kind of medial to lateral. So that's our liver. Let's take a look at our spleen. That's our spleen. Let's take a look at the adrenals. I know in textbooks they make the adrenal look pretty big and juicy, but in real life they're pretty skinny. So that's our adrenals. Let's take a look at the pancreas, our tail of the pancreas, the body of the pancreas. The neck of the pancreas is the part that is just anterior to the superior mesenteric vein. And as we scroll down, we see our head and the uncinate process of the pancreas. After that, let's go to our kidneys, our right kidney, our left kidney. And then we'll try to follow the ureters down. So here's the right ureter. We're following it down right here, anterior to the psoas muscle. Following it down more, and then it inserts into the bladder. We'll do the same thing on the left side. Here's our left ureter. We follow it down more. It's here, and we're following it down, and there it goes into the bladder. That's our urinary bladder. That's the prostate. As we go down more, we see the penis. And then after that, let's look at our bowel. So let's start with the anus, rectum, our sigmoid colon. Sigmoid colon is usually pretty tortuous. This person may have some diverticula here, but not a whole ton. As you go up, this is our descending colon. The descending and the ascending colon are usually the most posterior lateral bowel loops that we see in the abdomen. That's one easy way to identify. So let's say even if I randomly go on that slice, then just the most posterior lateral. Those tend to be the ascending and the descending colon. We go up, there's our transverse colon right here, our ascending colon. This is the terminal ileum coming out of the ascending colon. Here's our appendix. Appendix is usually much more easier to identify in sagittal and coronal views, but in this case, we can identify the appendix easily. And then let's take a look at small bowel just grossly. These are our loops of ileum. These are our loops of jejunum. And you can see immediately how the fold pattern is different in the jejunum versus the ileum. The ileum is kind of smooth and featureless versus the jejunum has these folds that we can see. Then I come up and let's follow the esophagus down. That's our esophagus. Going to the stomach. That's our pylorus. This is where the duodenum starts. And this is where the duodenum goes in between the aorta and the superior mesenteric artery and comes out here and then becomes the jejunum. So now let's take a look at the vessels and lymph nodes. For that, identifying the coronal view much more easier. So let's start with our aorta. This is our aorta. The first branch of the abdominal aorta is the celiac trunk. The celiac trunk gives rise to splenic artery and common hepatic artery right here. The common hepatic artery gives gastroduodenal artery, which is right here, and becomes the hepatic artery proper. The hepatic artery proper gives rise to left hepatic artery and right hepatic artery. The branching pattern can be different in different people, but this is one of the classic patterns. And this is our splenic artery right here. Right there, our splenic artery. In this case, the celiac trunk also gives rise to the left gastric artery that we can see right here. The second branch is the superior mesenteric artery that we see right here coming down. We can also see the renal arteries, the right renal artery and the left renal artery. And in this case, this person has two left renal arteries, the dominant one and the less dominant one. As we keep coming down, this is our inferior mesenteric artery, our common iliac artery, which branches into the external iliac artery, which is this one, and the internal iliac artery right here. So the internal iliac and the external iliac make the common iliac. Same thing on the other side. The external iliac artery comes out and becomes the common femoral artery, which gives the superficial femoral and the profunda femoral artery. And same thing on the other side. Then let's take a look at the IVC. So the IVC is pretty compressed in the liver, which tends to be normal. We see it pretty frequently. There's our right renal vein, left renal vein. This triangular structure we see is just contrast mixing. So the contrast is refluxing back from the heart and it's mixing with the non-contrast blood without contrast from the IVC, and that's why we see this here. We looked at the renal veins already, our common iliac vein, external iliac, and then we can follow it down in a similar branching pattern as the artery. And again, this thing we're seeing is just contrast mixing artifact. Sometimes we do catch deep venous thrombosis just by following the IVC down. Now let's go to the portal vasculature. So this is our portal vein giving rise to the left portal vein, right portal vein. This is our superior mesenteric vein, our splenic vein right here. This thing coming down is the inferior mesenteric vein. Sometimes the inferior mesenteric vein comes and mixes with the splenic vein. Other times it can come right at the confluence of the splenic vein and the superior mesenteric vein, and sometimes it just comes and joins the superior mesenteric vein. So that's our mesenteric vasculature. After that, let's take a look at the lymph node. Again, in my experience, lymph nodes are easiest to evaluate in coronal view. And one thing I'm trying to do in my life is just to get myself more familiar with using the coronal and the sagittal images. Because on axial, let's go right here. All we see is the liver, spleen, a little bit of kidneys, adrenal, but in coronal, we see the whole body. We see so much real estate that it's definitely more bang for our buck to use coronal images. So to look at lymph node, usually around the aorta and the IVC, we tend to see them. For example, there's one right here. There's one right here. And if there's retroperitoneal lymphadenopathy, we tend to see a bunch of lymph nodes just around the aorta and the IVC. And as you come down here, almost everyone has some prominent inguinal lymph nodes. Here we see a bunch, right there one, there's one, there's a few on this side as well. So that's our lymph node. And after that, I take a quick look at the peritoneum, the mesentery, and the fat in the abdomen. And again, I tend to find it easier to look on coronal and sagittal. Here, I just come up and look at this general area, and then go down here, look at this general area, and then do the same thing on this side. And later on other videos, we'll have CT scan with different pathologies, and it would make sense why I look at it this way. And after looking at this, then I tend to go to the bones. So let's go to the bones. And so we have our right femur here, right acetabulum, our ischium, our inferior pubic rami here, pubic body, superior pubic rami, acetabulum. This is our ilium, our sacroiliac joint, our sacrum, our left ilium, left acetabulum, superior pubic rami, pubic body, inferior pubic rami right here, our ischium, our femur, and then I look at each vertebral bodies individually. So I tend to scroll one way with one vertebral body, and when I come back, I go on the next one. And then when I go back again, I go on to the next one. When I come back forward, I go on to the next one. Go back one way, come back other way, and in this way, I take a look at each vertebral bodies. And then I take a look at the ribs. Ribs, I like to, unless I'm specifically looking for rib fracture or some rib pathology, I like to look at them grossly. For example, here, see how we see a bunch of different ribs on the same image. So let's look at the left-sided ribs and just come out and sort of pay attention to each ribs and go on the other side. Follow the ribs back, and we can see the spinous process as well. Spinous process, I find it best to evaluate on sagittal images. And coronal image, I really like to look at the transverse process too. So we took a look at the bones too. Now let's go back to the sagittal images. And to evaluate the spine, I like the sagittal the best. One of the first things I do is I just make sure that the facet joints are oriented normally, how the inferior articular process makes lines up with the superior articular process of the vertebral body that's inferior to it. And let's take a look at the spinous process. See how we see almost all the spinous process in a single image. How much more work it would take to look at spinous process on the axial, and see how easy it makes in the sagittal. And then we can quickly take a look at the ribs too. And then again, in sagittal image, I like to go through each vertebral bodies as well. And after I do that, then I come down and sort of look at the ilium, my femur, superior pubic rami, pubic body, inferior pubic rami, ischium, and do the same thing on the other side as well. Now the things that we still have to look at, our lung bases, the heart, and the soft tissues of the body wall. So to look at the lungs, I like to go back into axial, and we'll make it into a lung window, and then I scroll up and down. This person has some atelectasis right here, maybe a little bit right here too, probably some right around here. Sometimes we see pleural effusion, sometimes we even catch pulmonary embolism. If I go to soft tissue and sort of window it, sometimes we do catch pulmonary embolism. And then inside the heart too, sometimes we catch thrombus in the left ventricle, or if it goes a little bit high, sometimes we catch it in the left atrial appendage, which would be around here, but we don't see the left atrial appendage here. We can take a look at the pericardium here too. Sometimes we catch pericardial thickening. And then I'll look at the anterior abdominal wall, sort of go down. This person has a little fat containing umbilical hernia. Go down, these are the contents within the inguinal canal. If there were to be large amount of fat or bowel loop, then that would be our inguinal hernia. And after looking at the anterior abdominal wall, I sort of look at the thigh region. And I especially pay attention to the hip joint for effusions. And I come back up these gluteus muscles. I go back down the psoas and the iliacus muscle on the medial side. And I take a look at the medial compartment of the thigh as well. And same thing. So let's go down the medial compartment of the thigh, look at sort of the anterior muscles. And then when I go back down, look at the gluteus muscles. And then come back up, looking at these paraspinal muscles. And then go back down, looking at the lateral abdominal wall muscles. And probably the most common things I find while looking at this is just a lipoma. But there are cases where people find sarcomas in completely unsuspected cases where patient just comes in with appendicitis and we randomly diagnose a mass in the right paraspinal muscle. We do biopsy and turns out to be sarcoma. And then we can look at the psoas muscle one more time here. Here, one of the other things to try to look at that I still haven't incorporated into my search pattern is to look inside the spinal canal. Especially someone with lower back pain, sometimes you can see disc herniation and stuff. So for example, let me show you. So let's go to this level. If I go down here, you can probably appreciate the spinal canal right here, lined by the dura. And so I'm at the bone level. So, but if I go down here, the disc kind of protrudes out a little bit. See how the bone is sharp at this level, but if I go down here, the disc has a bigger footprint than the bone itself. Now, a little bit of that is normal, but if it's a lot, then you can have broad-based disc bulges or herniations. So that's something we can look at as well. So this is a general overview of the anatomy of the abdomen and pelvis on a CT.